My name is Vincent Mwita, working with the Tunaweza Empowerment Organization, and we've been implementing the Power to Youth project that is spearheaded by Amref Health Africa in Kenya. But from Migori County, we can categorically say that we've seen a number of young people with a focus of adolescent girls and young women getting capacity within the county, and also having that courage from the capacity they have received to now engage with other stakeholders, especially when it comes to the duty bearers, when it comes to other key community state actors. And we've even seen a number of them going for leadership positions, especially within the county governments. We have technical working group that now in Migori young people are actively and meaningfully engaging in. And when we were starting the project, the issue was that the young people were not meaningfully and inclusively engaged, and they were not even given the opportunity to participate. And even if they were participating through a representative, it was not that meaningful and inclusive. But we have seen the trend changing. There's something the project, the Power to Youth, have injected in them, and we can see now progress moving forward. And we can actually say that in the areas that we implemented the PTY in Migori County, there have been a rise of young people now demanding accountability, young people now working closely with other key stakeholders, especially on youth and adult partnership, in ensuring that they are getting to youth development agenda in Migori County. Cases of FGM are still there in Migori County, but we cannot compare it from 5 years ago. There are a number of dynamics that have really changed, and we used to see emerging trends like of FGM, like the cross-border. But with the onset of Power to Youth and putting resources in terms of engagement at the cross-border, we've ensured that we are having a very strong, active technical working group, just specifically responsible for countering cross-border FGM and other forms of violence. And being led by stakeholders, being led by the county commissioner and other state actors, we are now seeing this emerging trend of cross-border reducing, declining. We might not say that it has come to zero, because that is our vision of getting FGM to zero and even other its emerging trends. But we have seen a very huge decline when it comes to cross-border FGM. And also even young people. 4 years, 5 years before, young people had reason to say no to FGM, but with this project, we've seen a number of young people becoming advocates, becoming champion and activists, and even now we have a greater movement of young people in Migori County, in Kenya, now saying no to FGM, and not just saying no, being bystanders, they are taking real and meaningful action to end FGM in their spaces.
I'm Alice Masinte from Naret Intoyie CBO, an organization that was supported by Amref from Kajiado County. And what I can say is that Power to Youth came as a rescue, especially for Kajiado County, whereby we have a high rate of FGM, child marriage and teenage pregnancies. It has helped in the implementation and dissemination of the Kajiado County anti-FGM policy. And this policy has really helped us in tackling what we call the cross-border FGM that is happening in the border of Loitoktok and Tarakea, that is in Tanzanian side. It has really helped us that because we have cases of FGM have reduced along the border. Another very major impact that the project has brought is the formation of the networks. One, we have the Kajiado South CSO network, and in this network we are able to work together. We lobby for resources together. We even lobby for policy, for formulation and influence policies to be passed in the Kajiado County Assembly. Like recently, we have a policy that we influence, and it was passed, the Kajiado gender-based violence policy. And this policy is going to help us in reducing cases of sexual gender-based violences in Kajiado.
Thank you. My name is Enoch Chiteri from the Youth Parliament Movement country. We've seen a lot of innovations and initiatives that have been adopted to influence youth voices in challenging harmful practices such as FGM, gender-based violence, and as well as teenage pregnancies within the target counties. Very good innovations have come up in the last 5 years. For example, the Youth Parliament movement, which was influencing youth participation in social accountability and advocacy. We've seen adaptations of the Youth Parliament like Kusika Dada, which was influencing adolescent girls and young women's participation in social accountability and governance, as well as forums like Mura in Kuria. We've seen intergenerational dialogues in Kajiado, as well as youth adolescent circles and Vikao in Migori County.
My name is Afli Nyogo. I am from the Homa Bay Youth Parliament under the Power to Youth program. This is because we know that Homa Bay County, we are always at the top when it comes to teen pregnancies. So this project came in to help us build our capacity to influence and also ensure that the budgets are speaking to what the people are really going through at the grassroots level. So apart from that, we've also been engaged in terms of how to connect the local realities to the global realities, because we don't exist in a silo, but we have to synergize with other entities to ensure that all things that we are doing in the community are running well. Homa Bay County, we were always number 2. We were always top 3 when it comes to teen pregnancies. So we were taken through the training of like evidence-based advocacy and also just taking the human-centered approach, because we come from along the lake regions, and yes, the urgency is there. The kids want to engage sexually, and that one is an urgency there. It is a feeling that they have. But what happened is that we mentored these kids to understand, to go through the sexual education, and also just to understand that it is okay to have the feelings you're having at that moment, but please ensure that you make an informed choice if you want to engage. So from this, the education that we got, we were able to now address the root causes of this when we came together with the community and also the parents, and also again the kids, and also the people we assume to be the perpetrators in the community. So when we brought them together, it has been a journey that we've seen the data really reducing, but we're not yet there. But I can say now, Power to Youth has built a legacy of powerful youths who are able to address the issues and continue with the mentorship to the young girls and also the adolescents in our community. Yeah.
I work in the Assembly of Siaya as MCA representing North Kenya. My name is Dadala. This day we are here to assemble with the Amref Health Africa that has been running a project that basically focuses on youth advocacy, so that we give them voices to champion issues relating to health. It's been implemented for 5 years, and the impact that has been attained, I want to say, has been massive. And coming to me, because I have worked with it since the time of inception as a lawmaker in the Assembly of Siaya, then they've been able to build my capacity and really help me in terms of lawmaking. In the second assembly, I was there as a youth representative. Upon being elected, then the matters of youths were being handled, but there were no law to guide them. So when I knocked down of Amref Health Africa, and I was asking them that I have an idea that we need to have a youth bill, and that making law is something that it's very, very difficult, and then it needs various stakeholders to come into place, and then they share. And when I knocked that door, I'm glad Amref opened the doors, and we were able to come up with a youth bill for Siaya County. Then this third assembly, then I got elected again, and this time around we were looking at reproductive health and all those kind of things. And then again, I said that if we do not make a law that will guide these ideas, then we will not be doing any justice to our people. Again, I knocked the doors of Amref, and they were able to support me, and we enacted the Ramka Act. It's my joy to report that Siaya becomes the first county in Kenya to have enacted Ramka Act. And the Ramka addresses reproductive health matters, maternal child health, and it is a law that we are really impressed with, because other than that, we were able to establish a fund that basically looks at issues of sexual health. So with those, I want to acknowledge and say Amref has been very, very key in helping Siaya in terms of helping youths voice their needs in the society. Thank you so much.